So we are going to have our discussion with our stakeholders. So the folks that are the reason we're getting up in the morning, very important. So I'm Bray Patrick Lake. I serve as the Director of Stakeholder Engagement at the Duke Clinical Research Institute, and I will be the moderator for this session. Mostly I'm here as a patient representative for people with ADHD who fail to pay attention in mathematics, and I'm just really, if I would have known this had been so important, maybe I would have pushed through a little harder. But no, seriously, you guys, I really appreciate the work that you're doing on behalf of patients to give us access to great data. So we're going to keep this a little informal since it's lunch, and we've got some people that are eating and chatting. I'm going to ask each of our stakeholders to do just a brief introduction of themselves and share the lens that they're bringing into the conversation, and then we'll go through the comments that they have prepared to bring to this discussion. So, Tom, if you want to go ahead and kick it off.
Just with the introduction first and then come back? Or?
Yep.
All right.
Introduction all the way down, and then we'll come back to you.
Excellent. Okay, my name is Tom Concannon. I'm a senior policy researcher at the RAND Corporation and also on the faculty at Tufts Medical School. I've been working for 25 years, first as an advocate for people with HIV. Then mid-career went back for a PhD and have been working around high-intensity conditions and modeling health services delivery. Of interest to me as a result of this has been stakeholder engagement, including patients, clinicians, and all other kinds of stakeholders in health research. And so I've been working for some time now on developing approaches for that. And that work actually ends up threatening all of the other work because it's taking over all of my time. So that's enough on me. Thanks.
Good afternoon. My name is Seth Morgan. I am a fellow of the American Academy of Neurology and was in private practice 14 years ago when I had the unique experience of diagnosing myself with multiple sclerosis. I worked on for several years and then left practice feeling that I really was not doing an adequate job. And over the last 13 years, I guess 12 years now, because I stayed in practice for 2 years, I've been a patient advocate for the MS Society and for people with disabilities generally. And I'm here to tell you about the failure of my treatment.
Hi, my name is Christine Stake. I am here today as a patient representative, and I will be talking to you about my stories. And I am also a surgical outcomes researcher, and I'm also doing pain research for pediatric population at Lurie Children's Hospital in Chicago. And I came to know Dr. Concannon through my work in PCORI, and they were doing focus groups looking at patient-centered decision-making around hip replacement. So I attended one of their focus groups because it was an issue that was very important to me, and I became more and more involved through that. And so that is how I ended up here today advocating for patients, and he has allowed me that opportunity to do that.
Hi, I'm Bobby Du Bois. I'm a general internist and the Chief Science Officer of the National Pharmaceutical Council. We are a Washington, D.C. based policy think tank funded by the pharmaceutical industry, and so I'll try to bring a perspective from that industry into the discussion we're having today.
Hi, I'm Karina Davidson. I'm a professor of medicine and psychiatry at Columbia, where I'm a vice dean, and I'm also the chief academic officer for New York Presbyterian. The role I'm going to try and bring to today is as a member of the United States Preventive Services Task Force. My personal research program, I do large randomized controlled trials in depression and heart disease, but I've become increasingly fascinated with the methodology of N of 1 trials, or completely within subject, single subject designs. And I had a heterogeneity of treatment effect grant from PCORI to start that work.